COVID-19 is something which has affected most of our lives, some of us more than others. We're reaching more than 103 million cases in the world. Over 2 million people have died in the last 1.5 years from COVID-related deaths. So the question is, when will COVID actually end? The biggest way to solve COVID-19 is through herd immunity. Herd immunity can be described as when a sufficient portion of a population is simultaneously immune to prevent sustained transmission of said pathogen. The pathogen in this case is COVID-19. If you're watching the news, the UK has discovered a more transmittable type of SARS-CoV-2. That's the scientific name for COVID-19. This already more transmissible pathogen of COVID has been detected in countries like the UK, South Africa, and 30 other nations. It is said that the UK strain is more transmissible by 40 to 80%, which is a considerable gap. Most of the data I'm about to show you comes from the UK and the US. And the reason for that is most research happens in these countries and not in other countries like the one where I live in. And hence it's easy to show you the solutions that are happening in those countries and the graphs and details of when those countries may expect a normal environment to return. And then we can deduce when that will happen for our own countries. So herd immunity is said to be reached in the UK and the US probably by the end of 2021. The chance of it happening halfway through this year is highly unlikely, and the chance of it even happening at the end of this year or the third quarter is also in question. A lot of factors could delay the timelines of vaccines, especially, including unexpected safety issues, further mutation of the virus, and herd immunity will also require vaccines to be effective in reducing the transmission of SARS-CoV-2, which we will get to later. Now let me show you a graph which can sort of put the idea in your head of when the UK and the US can sort of expect normalcy. So on your screen, what you're gonna see is a graph. I'll put the link in the bio, in the description for you to check it out later. It looks kind of complicated now, but let me explain to you what's happening right here. So on the y-axis, we can see vaccine efficacy, so how efficient the vaccine is against COVID-19. On the x-axis, we can see vaccine coverage. So what's the coverage percentage of the population that the vaccine rolls out to? On this other axis, on the opposite of y-axis, what we can see is a sort of range of current assumed natural immunity. So what is the percentage of the public that is just naturally immune to the virus, that they won't need the vaccine essentially? And if you plug in that value of natural immunity to other values, and you use essentially a basic reproductive number, RO, of 2.4. Anyways, if you plot those values out, what you're going to get are these dotted lines here. Essentially, 0% of the population is naturally immune. It forms a dotted line here to help us understand what sort of vaccine coverage we need and what sort of efficiency we need for herd immunity to be achieved. So right now, what we can see is in the UK and US, natural immunity ranges between 5 and 20%. That's sort of the data that we're receiving. Vaccines tend to be 95% effective. That's sort of the average we get from AstraZeneca, Oxford, Moderna, Pfizer, BioNTech, and so on and so forth. And so the points where the efficacy and hence the natural immunity intersect gives us the vaccine coverage that we need. And it's around 50 and 60%. And again, this is for the UK and US. It won't be the same for countries all over the world. But this should give you sort of the idea of what we can expect in terms of the coverage we need before we can expect some sort of return to normalcy in our social lives, in our lives in general. So again, that question begs, even if this happens and all the problems of rolling out these vaccines is such a big portion of the population, if those problems don't come into effect and we avert those disasters, will COVID truly be eradicated? And I've done research, I've looked through websites, and most scientists believe no. And you may have thought about this yourself, but COVID will become normal. You know, That goes with saying that some parts of the world, like the US and UK, will become herd immune. But then again, that's not the same for every country in the world, especially poorer countries or countries with larger populations we can't be controlled, countries all over the world. They won't have the same opportunity as the US and the UK. So across the world, there's an increasing consensus that this virus will become endemic. So basically, endemic means normal of a people. So just essentially, it will exist. And sure, you can sort of relate it to flu or even measles. So this is David Hyman. He's the chairman of the World Health Organization's Strategic and Technical Advisory Group for Infectious Hazards. That is a really long name. He noted in December that this virus sort of may become local to certain parts of the world. COVID-19 may become sort of like measles. Measles has, of course, limited intermittent effects and outbreaks in countries with well-developed vaccination programs and schemes already in place. But in nations across the world, in other parts of the world with not this well-developed structure, this disease is an ongoing disease, and hence COVID may become exactly like measles. Another possibility, and I strongly believe this, is that COVID-19 will become seasonal in nature. There will be predictable annual peaks, such as in the winter months, and considering that winter is always occurring in some part of the world all the time, these peaks will be sort of strange to look at, but there will be sort of an identifiable group, like flu, of when COVID-19 and when coronavirus will be most active in these certain parts of the world where herd immunity may well not be achieved. So, in summary, COVID-19 will not disappear during this transition to herd immunity, but it will become a more normal part of the baseline disease burden in society, like flu, for example, and it will certainly become seasonal. Now, before I mentioned that a factor in the playing of herd immunity is the transmittability of this disease, and we know that the transmittability of the disease is slowly increasing from the UK strain. However, good news is that the Oxford AstraZeneca vaccine has shown signs of it being able to reduce the transmission rates, which is fantastic. Vaccines typically only help with reducing the symptoms on the carrier of the virus, but it won't aid in stopping that transmission. I mean, I could have no symptoms with the vaccine, but I could still transmit the virus to my grandparents per se. But with the AstraZeneca Oxford vaccine, we see a reduction in that, and that's fantastic, and that's great news for the world. That is certainly good news and sort of gives us hope. But again, COVID is slowly but surely gonna become normal. That's about it, guys. Thank you so much for watching. I hope you learned something. This is certainly a very debatable topic with many views, but everything I said in this video is based on scientific consensus and a mutual view, sort of from a broader range of scientists and medical researchers. If you guys have any questions, leave them in the comments. If you guys have any suggestions, also leave in the comments. If you guys liked the video, make sure to like the video. If you guys loved it, make sure to click that fat red subscribe button. If you guys, of course, have any suggestions, remember, leave them in the comments, and I will be sure to do some research in them and hopefully make a video. That's about it, guys. Thank you for watching the video. If you reach all the way to the end, you're awesome. And of course, see you on the next one. Peace!